I think at the Health Benefit Exchange, we have sort of a pretty bold equity statement, and we've been leaning into social determinants of health and really trying to look at what are all the facets that make someone healthy and what are all the things in their environment that prevent them from being healthy. So these kind of programs where you're looking not just at access to healthcare, but also affordability of healthcare, and also barriers, language access barriers, accessibility issues, health literacy barriers, where you're looking kind of holistically at someone, trying to meet them where they are and trying to get them connected to healthcare. That is sort of a broad health equity, social determinants work that our board feels pretty passionately about, that this kind of initiative fits squarely into. So it's been an exciting fit in terms of fitting a broader equity strategy. More specifically, this program brings people's premiums down to zero. I think there was an acknowledgement that for some people, paying a partial premium is a barrier. So I think that was one key component. I think making sure that there was free enrollment assistance available was part of trying to make sure the program could be accessed in an accessible way, and then providing the additional kind of language access, disability access services as part of providing one-on-one assistance to people. I think is something that we're, in looking at it with an equity lens, we wanted to try to make sure that could make the program as broadly available as possible. I think with the work of DCYF, we've done a lot of translations of materials they mentioned between the sort of interpretive services and translated services, really trying to make sure that we're meeting people where they are, and really trying to make sure our call center and our navigator organization has evening hours and is working during lunch to provide people an opportunity to access the service was also important to us.
I think I would just go back to, again, we know that our childcare provider population is disproportionately women and women of color, and that when we think about wages and compensation for childcare providers, we have, as Joan has sort of highlighted, many of them are actually eligible for public assistance and other benefits, right? And so how are we really making sure that they are getting access to something that they really need, and it's being done in a supportive way, as Joan noted, meeting them where they are. And I think the navigators and the language access piece are huge. And I think we've been able to learn from each other about how to do that. And I think this again, really also, I think, helps DCYF meet our racial equity and social justice goals related to making sure that providers are reflective of the kids and families that they're serving. And part of that means you need to be thinking about what is the compensation, benefits, and access to healthcare and other pieces they need in order to be able to stay and do that work.